Hey, GP learners. So in this session, I'm joined by Andy from our eGP Learning Podcast and also Matt Badeau, who's a GP down in London. And we're going to talk you
Hello.
through how to use MS Teams effectively, because obviously many of our colleagues are going to be signing on to using this platform. It's been provided for 3 months free for effectively for NHS workers, particularly in primary care. And a lot of you are probably going to be using this to help support your remote working. So we're just going to get cracking and show you effectively how the system works. Hopefully you've checked out our video that shows you how to register and do some simple settings changes to make life a little bit easier for you. But once you're in, you kind of need to basically get onto a team. So Andy's going to show us how to do this with Matt's support because Andy hasn't used the system yet.
Yeah, so I'm the novice in the room here. I've not used MS Teams yet, so you can walk me through this step. So this is where I've landed. I've registered. Matt, what do I do next?
So yeah, simple thing is if you click on to join a team, and then in that little box you'll see there, you just got to put in a code, which hopefully you should have been given by whoever owns the team.
Okay, so I've been given a code by Gandhi for one of the teams that already exists. I'm entering it, and I've done it. So, okay, that seems to have landed me nicely in some sort of team environment. Great, thanks for that.
That's right. So you can see there, you've got the name of the team, and then just below it, you've got your separate channels. So one is general, and then you've got 3 hidden, which you can just click on and see what they are.
Okay, cool.
And you can unhide them depending on if they're relevant to you.
Excellent. Look pretty relevant. Thanks, Matt.
And I guess, Matt, can you explain to us these other kind of functions? So as you can see, we've got this general section at the top kind of left, and then we've got some other words like post, files, and wiki. So what effectively are they?
Yeah, so you've got the post section is probably where you're going to spend most of your time in each channel, and that is the general chat that's going on, the notifications. As you can see in this channel, it's pretty much just showing loads of people joining the team. But if you start a conversation in here, the key thing is knowing that they're kind of threaded conversations. So you start a conversation and you can reply underneath that conversation. So rather than just having a million different, like WhatsApp, you kind of are struggling to find the thread of a topic. This one is a little bit easier because you can start a new conversation with one topic and then start a new conversation underneath that, and it will just organize it nicely for you.
So I guess as an example to a lot of our EGP learners, and like you said, it's not like WhatsApp. It's probably more like the Facebook discussion threads that many of you probably have used and stuff. It's more that kind of structure that you need to be aware of.
Yes, exactly like that. The files section is kind of your document storage. It uses SharePoint and OneDrive to kind of arrange it all and store it all. So you can share files amongst the whole team using that. And we haven't really put anything on this one at the moment. You can upload files straight on there. If you upload a file onto the post section, it will then get stored in that file section, so you just come back and find it. The one useful thing I find here is you have a sync button at the top. If you click on that, you'll see that will synchronize with your OneDrive. So therefore you can, if you've kind of got a big storage section of files there, you can actually synchronize that to your OneDrive and to your PC, just like Dropbox would.
Cool.
Okay, cool.
And quick little tip I tend to mention to people. So one of the benefits of this as well with the syncing is that you can work collaboratively on documents, kind of like how OneDrive and Google Drive work. Important to remember when you make changes, it makes them live. So if you wanted to keep a previous copy of the document, you can rewind, just like track changes kind of mechanism within Google Drive and that kind of stuff. But the changes do happen for everybody on that document unless you saved a copy of it elsewhere. So it's an important thing to remember. So, I mean, this would have been really effective when people were making their schedules back at the beginning of PCNs. I can imagine very soon we're going to have similar sort of stuff that we need to do. So really effective at collaborative document management and stuff for people in their teams and stuff. I guess current situations, re-updating COVID protocols and all that kind of stuff just means you can do it live with your team.
Yeah, and precisely that. I mean, this is actually the one thing that actually initially attracted me to Teams was that live document stuff to do the schedules for my PCN. Just because the concept of emailing that round to people and everyone just sending around version 10, version 11, just I couldn't bear. So this actually answered that really nicely.
Yeah, and I think I can see some similarities between our local sort of communications platform, TeamNet, but this seems to go a little bit further in terms of providing an ability to live edit and share and keep those documents up to date. I don't know what you think, Gandhi. I think it's going to be a debate locally, Teams versus TeamNet, isn't it?
I think so. And we may see a shift of people moving away from using TeamNet as a communications platform over Teams, each place to make their own decision. What's the difference between the wiki function and stuff, Matt?
So the wiki function is something I don't particularly use or know too much about, but I think it is kind of like a notepad area just to put useful information about that channel. But again, it's not one I've ever really used or got involved in.
Yeah, I guess one of the things I've seen people use it for is for an onboarding mechanism for teams. So this is where you can have your team rules, this is where you can have your team structure, what this particular team is about, so that when people join, rather than having to ask the questions or what's the terms of reference, that kind of stuff, yes, you can store that in files, but having it in the wiki is a good place because you get sections and that kind of stuff, and people just to kind of have a quick onboarding mechanism for each team. I think this is a more sophisticated thing that people may not want to use, but could use it depending on the structure and function that you're trying to get from your team. There is a plus button though, so you can add other stuff as well, can't you, Matt?
Yes, I mean, that's probably a really, really useful feature. If you click on it there, you can add different apps. So the classic one would be Planner. So you can add, your own little kind of, it's similar to Trello, but you can even do Trello there as well, or a OneNote drive, or anything similar like that. The one thing I've added so far on this channel, you can see if you go to the channel of the COVID channel, if you just click on the hidden channels down there, and then the COVID-19 channel, you can see one thing I put up there is the useful COVID resources channel. So that actually is just linking straight through to Google Drive. Now I can see, because you're loading this in a browser, it might not load it natively, but if you're using it on the desktop app, it will work straight from there.
Okay. Sorry about that, guys.
That's all right. So I guess it's important to remember there are different ways you can access Teams. So you can use the app itself, and that can be an Android, iPhone, or based on your Windows PC or laptop, or you can use it through a browser. So if you just wanted to dial in and use it, as you can imagine, the app functions have a little bit more depth in terms of what they allow you to do and function. It is a really good resource. So like you said, uploading national COVID resources can be quite an effective way, websites, that kind of things. The planner function I can see being really useful for helping the team to understand where their deadlines and stuff are, like you said, with the planner function.
So Gandhi, I've just realised I'm the novice, and I've ended up in the driving seat here with the screen. So it might be a good time to switch over to Matt's screen potentially, as the expert, and he can show us what it's all about.
Cool. Shall we do that, Matt?
Yeah, sounds good. Can you see my team there?
Yeah, definitely.
Brilliant. Cool. So I'll try that again. If we go to the COVID channel, then you can see, click on COVID resources up here. You should see now everything appears there. So yeah, the good thing about this is it's just nice and quick access. So yeah, all the things here, the ones, if you have a common file like a spreadsheet that everyone's using, or OneNote, but the classic one I think is Planner. Is very useful there.
So definitely planner function. I guess a lot of local areas will have their own kind of local resources or practice-based resources that they may want to just have easily and quickly available. It's a nice, simple way of having it available for people to find. I guess it's just important to prioritize what information you need. Don't stick everything, because there's obviously a limit to the number of things that you can see easily, and you don't want to overload yourself. So Matt, can you show us how to create a team? Because that'd be really helpful.
Yeah, sure. So this is actually not done in Teams. You actually have to do it in your NHS portal. And the annoying thing with this is actually you have to be a local admin to do it. And if you're not, just check if your practice manager or someone else in your practice is. Otherwise, you do need to contact your IT help desk. But I'll show you now how to do it if you've got that right. Okay, so if you can see, I've logged into my NHS Net portal, and I have an admin option here. So if I click here, and then I've got Teams. So I click now, and then this is essentially how to create it. So I just click on Add Team, and I can put the name. Is it a private channel? So is this something which I'm creating and I manually add who I want to be into that channel? or is it public? Can anyone else join it? And then I select the organization, which of course is my own practice. And here I can add owners and members. So you read this as owners are people who can create channels and edit things, but depending on how you set things up, members may have restricted access. And then you create it and it's done.
Cool. So if you wanted to create it across practices, like for a network team.
So what you would do with that is you just create you can still create, even in a private channel, you can add anyone who's on NHSNet. But you can create a public channel, and that's someone who essentially they don't need permission to join. If they can find you, or if they've got the code, they can join it.
Okay. So if you're creating a network-based team, you'd create a public one and send people the relevant code to join your team. If you're creating a practice-based one where you are an admin rights user, it'd be typically a private team, and then you can add in the relevant people from there as you see fit.
Yeah, but I would still probably say your PCN team should probably be a private one, and then you can manually join them on, because I would think that a public one might be searchable, and therefore if someone random finds it, they can join onto your PCN team, which you probably wouldn't want.
Fair enough. Good tip to know.
And Matt, can I just ask a question about information governance? So can we, presumably in a private practice-based team, can we share patient identifiable information? Is that allowed?
So this is something which I haven't had a firm answer on. And the reason I've been using it for Teams for quite some time is within my CCG, we actually ran the pilot to use it for the PCN. And towards the end of that pilot, we were about to run a pilot using patient identifiable data. From what I know is that structurally, everything is ticking every box that it needs to tick, but I don't think it's been officially signed off to have patient identifiable data. So I would probably err on the side of caution and say, listen, don't put it in there yet until you are specifically told you can.
And I think with that, I'd echo that. I know that there are some rapid changes happening when it comes to digital companies and digital work and stuff to try and facilitate a lot more of this kind of thing happening. They have opened up the DPS, so the digital provider service, the dynamic purchasing system they have for companies who want to provide digital offerings to NHS services. And potentially MS Teams may be one of the further environments that becomes part of that, so therefore more effective for patient use. Yeah,
I think probably the main thing actually we should start off talking about is the difference here. So you've got your chat section. Now this is very much like WhatsApp. So simple kind of easy chat. It's private, and that's the thing. So you can have a group, or you can have one-on-one persons, but that's not going to be shared with the whole group. Where if you've got your Teams section, this you pretty much should regard as public, as in public amongst the whole team, not to the general public. So things you put here, pretty much everyone can see. There is a slight stipulation with that, is you can create a private channel. So the classic example in my practice is we have a partners channel. So therefore, all the documents that go into there, all the chat that goes into that is all private, and only the partners can see, and none of the admin staff can see. But apart from that, that's the main conceptual difference.
And I guess one super user tip that I took from Matt, create a channel for yourself that's private. And then you can send important documents and things that you have that you want available to reference to or to access through MS Teams just to yourself. I know a lot of people use this potentially on WhatsApp as well. You can create your own WhatsApp group effectively, where you're just the only person in it. And that's really useful to use cross from mobile to desktop. And you can obviously use this function to cross post information quickly and effectively, particularly chats and that kind of stuff.
Yeah, exactly.
Awesome.
And then the other thing is you've got your calls. So if you wanted to call someone up, either a video chat or telephone conversation, you can just do it easily through that. The useful thing is that we don't need to now all share our mobile phones. We can look each other up, and if their settings have allowed it, we can pretty much call them up straight away. And then you've got your files section. So this is an amalgamation of all the files that are in each channel, so you can access them. But you can also add in your other stuff. So your OneDrive, you can add Dropbox or other storage mediums.
Cool. So we've talked about teams. There's a difference between teams and channels. Can you just explain that difference to us, Matt?
Yeah, so if you look at your teams, so I have several teams here. Now, this is kind of like your one group. So this is the whole project of the team. So the PCN National Group team, that is for everyone who is involved in PCNs to join that one team. Now, in that team, there's different channels. So these are different subjects that may be relevant to some people, not everyone. So therefore, you create different subsets. So the way I would describe this is, this would be WhatsApp, and then this is the different conversations that we've all got going in our different WhatsApp chats, but I've just amalgamated them into one.
Mm-hmm.
And therefore, it just allows you to basically create different sections and make things relevant to some people and not others.
Yeah. So I guess a suggestion I would have to many people now starting to use this within their practices or within their networks. So your team potentially could be your practice. And within that, you'd have a subset of channels, like Matt said. So you could have a partners channel, you could have a nurses channel, you could have a clinicians channel, you could have an admin channel, you could have a tackling COVID channel, for example. And then when you're looking at it from a network, it's just a different team that you've got. So potentially you may have the board members from your network from each practice as part of your network team. And then again, you can have subsets. So if you're looking at a project that's looking at developing a home visiting service, you can invite people that are just working on that particular section and have them work as that team. So it just helps to compartmentalize and not flood everything. Like, unfortunately, that's one of the downsides of WhatsApp. You get all or nothing, basically. But it allows you to have that structure that hopefully means you can be a little bit more productive. And then that also integrates all the other things that we've seen, like the calls, like the video chat.
Well, can I ask a question about tagging? It feels like that's relevant to the messaging area. And it's something when we were talking before, you said, don't forget about tagging. It's really important. So what about tagging?
So tagging is probably the one thing that is incredibly useful and makes it very different to your typical WhatsApp. But it's the one thing that probably most people will do wrong and therefore make it quite annoying in some ways. So tagging is the ability to essentially notify people of whatever you're writing. And you have to do that in order for them to get a notification. So if I'll show you an example here. If I go into the general team here, what I can do is I can say, I can just write a test message here. Now, if I write that and I send it, no one's going to get a notification. But if they go into the channel, they'll see it there. But if I wanted people to see it, what I would do is I would tag people in. So I could write say your name right. There you are. Then I've tagged you in here, and then the message I get, you will get a notification. Now, if I wanted everyone to see that, I could tag the actual team. So if I do @PCN National Group, that whole team will get a notification. So generally, if you've got an announcement to make, you should tag the team. Or you could tag a channel, so something like @COVID, and then anyone who's in that channel will get that notification. So that's the one thing that's particularly useful. You can really granulate this. So if I can show you, if I look at my team, I can manage the team. I can go into everyone in this team. Now, I probably won't load that list up right now, but once I click in there, I can do something called tags. So I can create a tag for, say, in my practice for GPs. And then now, when I'm creating a tag, if I'm writing a post, I can type in @GPs, and then everyone who's got that tag will get a notification. So it's a way of kind of saying, right, I want this person to see this information, and everyone else, they can find it if they're looking for it, but they're not going to be annoyed by a million notifications coming through their system.
And I guess the way I try and explain this to other users, so a lot of our viewers hopefully are people that use Twitter. And it's basically the same mechanism that Twitter uses. So if you put a tweet out and don't put on it, it just goes into your normal feed and people will see it or might not see it depending on whether they're looking for it. The moment you tag them with their kind of handle, so that's the function and then their name, they'll get a notification saying, oh, this person's messaged you. And the difference with Teams, it allows you to do that across teams and across channels And as Matt showed us, if you're tagging individuals, you can even do that across groups that may be more relevant and stuff. I guess one of the important things to show is what those notifications look like, though. So there are various different depths that you can get notifications. I know one of the main ones that Teams uses is the banner one. So all of you are now watching on Matt's screen. I'm going to send him a message. And you should see a banner come up in his bottom right-hand corner that basically shows the notification.
So you haven't tagged me correctly in this one.
So I haven't. So let's try that again, shall we? So Matt, there we go. Let's do that again.
Brilliant. And there you go. So therefore, yeah, my screen's just pinged. And at the time, although because I was in the channel, you just see a little number come up in here as well.
Mm-hmm. And that's how the notifications effectively work. And as many of you probably saw in our previous video, it's important to look at how you want those notifications to come. Some of them are set defaults as banners, some of them are set as default as in the feed, and some of them are set as default as banners and email. So you will get an email every single time somebody tags you. So definitely go through that section.
On that, what will happen is if you haven't looked at it, so I think it's if it's been there for about 10, 15 minutes and you haven't actually loaded up Teams and looked at it, it will send you an email. But if you do immediately go in and look at it and have a look and see that notification, then it won't email you. So it's not every single one, but it's enough to want to review your settings and just check that works for you.
Cool. So we've covered Teams and channels, and we've covered notifications and tagging. What other kind of stuff do we want to show people?
One of the buzzers around this was about doing video consultations. Initially, this was touted as a video consultation or at least meeting solution. So I'm pretty keen to hear a bit about that.
Sure. So there's several ways to do this. Probably the simplest way, if say you just wanted to speak to one person, you can find that person. You can either search for them using the search bar at the top, or even you can load them up here. And if you just hover over you, I can see that I can immediately start a video call. I don't know if you want me to try and do that on here or leave. I don't know if that's going to mess up the whole system. Shall we try it?
Let's give it a go.
All right.
Apologies if this doesn't work, guys, because we're using screen recording software, but it may do. So I can see Matt calling me. I'm just going to click OK. And hopefully you will now all see me, maybe.
Oh, I think because my webcam's going.
Yeah.
Probably.
So important to remember, if you are using multiple systems at the same time, it may not work. So Matt's currently using his webcam to do a Zoom call at the same time, hence why it won't allow us to see anything, and vice versa. I'm doing the same. But other than that, it would have worked perfectly fine. So it's just important to remember those kind of differences that you will see. And you can do that, again, to individuals. You can do that to teams. So you can set up meetings really quickly and effectively. I guess it's important to know where those meetings are going to be stored. So I'm guessing that will be in the planner, is it? Or
they tend to come into your calendar directly in Outlook. And that's how I tend to find them. So I can show you how that all works through Outlook if you want. I just need to change, I think, my share.
But I think it is important to remember there is a difference between your Outlook calendar and your Teams calendar. They're not completely integrated as such, if I remember rightly, are they, Matt?
No. So from what I understand, they are going to be more and more integrated as time goes along. So if I bring up my calendar here, can you see my calendar there?
We can see all your emails.
Oh my God. There's nothing very interesting there, don't worry. So
they'll be all fuzzed out.
Yeah, so you can see this is massively disorganized, but let me get rid of some of this stuff actually. So looking in my calendar, the way normally, if you create a meeting, it should appear in your calendar here. But the way I tend to start our PCN meetings and organize them is I just literally will see this option and click on New Teams Meeting. And then an option will come up. I think it's probably not sharing that one. But then you can just create, as you would normally do on Outlook, create a meeting, but that will contain an individual link that user can use to log into that team. So they just click on the team, they click on the link, and they come straight into the meeting at the right time.
And that's it. It is as simple as that. You get a link, you get notified of it, and you dial in. It is as simple as that. I guess another thing that I would really recommend people look at using is the command bar that Matt showed us earlier. So that's the bar at the top.
I'll come in tomorrow.
Cool.
All right.
So as you can see, right at the top, there's a search or type a command, and that's what's called the command bar. And this is like your overarching search mechanism that lets you find pretty much anything within Teams. It's also got some really powerful shortcut functions, which we're not going to cover today because that's a lot more advanced user system mechanisms and things. But it basically allows you to do a lot of things. So you can set up chats direct from the command bar. You can respond to things direct from the command bar. And it can streamline a lot of the work that you're doing. I would recommend, as I said, that's an advanced user kind of thing. If you're just starting out, don't worry yourself with it, but it's a great way to find things. So it's your search bar effectively for doing stuff. I guess the other thing just to remember, so we talked briefly about the planner function. So this is a mechanism that allows you to plan meetings as you go along, and you can use this as like some people may know the term Gantt charts. Or Trello boards another way, and that's just basically a mechanism of bringing work forward so you can plan your projects, your things that you're trying to change or do, whatever, and make that more visual, and it's shared across the entire teams. Again, we're not going to cover that today because it does require a little bit more depth, and we'll probably do that as a future video, but I think it's worth knowing about that function as people start moving forward with things. Important to know the IG side of things is pretty much covered. So because this is a NHS.net Teams offer from Microsoft, that only people within NHS.net accounts can actually activate and use it. If you want to share this information with patients, you're going to need a separate mechanism like another account to share outside of that. And effectively, it's a pretty quick and effective system to use that has a lot of power, and there is additional function that's being brought in. So a lot of the meetings mechanisms that are in Zoom, for example, like raising your hand and streamlining meetings in that sense, they are bringing that into Teams as time goes on. So they're developing constantly and updating it. And because it's Microsoft, it worked pretty well with most NHS equipment, which is a really cool thing. Less, hopefully, issues in terms of interoperability. I guess just to remind everybody, there is a 3-month offer from MS Teams for practices and networks and stuff to use. Clearly, there may be a question of how to use it after that. But this is a really effective potential mechanism to coordinate your remote working across practices and across networks, particularly in our current COVID environment. Thank you, guys. I think that's been a really useful and detailed look at how to use MS Teams. Hopefully a lot of our colleagues will find this really useful getting started with using MS Teams, because I know a lot of places are looking at using this as a mechanism to provide business continuity, but also to provide support, because a lot of us are now working remotely and you don't really want to be isolated. And this is a mechanism, hopefully, that can allow people to feel at least still part of the team whilst not physically being in the building and things. As always, if anyone's got any questions for us, feel free to contact myself or Andy through the normal routes on social media. I know Matt's being really supportive to a lot of the clinical directors in setting up national groups and stuff. And again, I know you're available on Twitter as well, aren't you, Matt, to field any comments or questions. And if you guys want more detailed kind of stuff like this, let us know. We're more than happy to try and arrange a time to cover more detailed content and stuff. As always, if you're listening on the podcast, feel free to leave us a review on iTunes. We'd love it if you could do so. Do check out the video as well. It's been, again, this is quite a visual episode. And as always on YouTube, if you're watching us, feel free to subscribe, ring the bell to get notified of all our content, and definitely leave us a comment. You'll get guaranteed to get a reply. And as always, EGP Learning's here to help save you and your patients' time by tech enhancing primary care and learning. Catch you in the next episode.